it is election day, and this year there are many healthcare policies on the ballot that would greatly impact both healthcare workers and patients.
That's right. 9 News medical expert Dr. Kohli is joining us live this morning to discuss those policies. Dr. Kohli, good morning.
Good morning. What a big day.
Absolutely. So thank you for being here and making the time. What is the top healthcare policy issue in this election?
You know, from a physician's perspective, but also from patients, I think reproductive rights for women is top of mind for every single one of us. And there are many different issues really within reproductive rights that I think we ought to discuss. The first, whether it's a federal or a state issue. This is where you see the Democrats and Republicans widely divided. Democrats thinking it's federal, Republicans thinking it's state. Second, at what age of the fetus is it legal to have an abortion? Republicans say less than 6 weeks, which is often not even before a woman knows that she's pregnant. Democrats saying up to 24 weeks if necessary. And then the third, mifepristone. Is it okay to have access to mifepristone, which is an abortion drug, 2/3 of abortions? Again, widely divided on this issue as well.
What about IVF? Where do both parties stand on that?
That's interesting. Actually, both parties seem aligned on this. So this is a bipartisan issue where both parties think access to in vitro fertilization is an important right to protect. Now, what happens to the embryo after conception? That's where things get a little tricky, because when does life begin? Is it when that, egg and sperm are fertilized together to make the embryo, as the Republicans think, or is it after the baby's actually born, as the Democrats think? So that starts to become a little trickier.
What is another big issue for candidates and Americans in this election?
I would say healthcare costs. As we all know, up to 45% of Americans say they have major insecurities about paying for drugs, paying for health care. And so the Affordable Care Act, which used to be called Obamacare and has now been rebranded as the Affordable Care Act, that's hugely divisive. So we have the Democrats believing that access to health care is a universal right and that there should be federally supported programs such as the Affordable Care Act and the Health Care Exchange. On the other hand, Republicans believe it should really be more of a private industry where the access to health care should be based on having the resources to get it. So it's going to be interesting to see where it goes. I don't think the Affordable Care Act is going away. And from a physician's perspective, it's muddied the marketplace quite a bit because there are people at all ranges of resources. And it's hard as a physician to know what you can deliver to who that still stays compliant within the limitations of the marketplace.
So a survey shows that many more issues that Americans consider to be the greatest threat to us for public health. Talk a little bit more about that.
Yeah, this is really interesting too. So if you asked, and this was a New England Journal of Medicine study, which surveyed Americans and said, what do you think is the greatest threat to public health? And the top one was opioids and fentanyl. And soon after that was obesity, actually, which we've talked a lot about on the show, the new medications for weight loss and such. But another one we're seeing on there is cancer, because we're seeing a lot of cancer in young people, and climate change. So I think in addition to everything we've talked about, these types of issues, and gun violence, of course, which we talk about over and over again as being a very divisive issue as well, they're going to continue to be top of mind. And I think this election is really going to impact these issues so tremendously that we could see a whole change in healthcare delivery, both from a physician's perspective, but also from a patient's perspective, that could have a ripple effect on how we get our healthcare and our medications.
Yeah, a lot of big impactful things on our ballot this time around. Dr. Kohli, we always appreciate your expertise on the matter. Thank you very much.